I know. Do we have a quorum to get started? Do we need to wait a minute or two?
We'll ask Chelsea. It looks like she's tracking it.
Oh, sorry. It'll maybe just a couple more moments. We just have, I think we have 8 left. We're on.
We can give folks a minute or two to get on the call.
Actually, it looks like we have 12. Yes.
We have a quorum.
Yay!
Well, hello. I guess I'll go ahead and get us started. Hello, everyone. Thank you for calling into our board meeting this month. We're not having a leadership council every year when December rolls around, but at least we still have our board meeting, and looks like the staff has been busy and put together a nice agenda of items for us to get through. Brian couldn't join us today, so I'm stepping in. I'm gonna go ahead and get us started with introductions. I think what's usually easiest is, Chelsea, do you want to call on people and folks can introduce themselves as you call on them?
Absolutely. So I will start with the board members that we have. So Sandra, thank you for introducing and welcoming us. I see Madeline Carlson's with us.
Good afternoon. This is Madeline Carlson with People for People, representing transportation.
And we're getting a little feedback. I think it's coming from Eric's microphone. So Eric, I'm going to mute you just for a few moments, if that's okay. All right. We have Rhonda.
Hi, everyone. Rhonda Hoff, Yakima Neighborhood Health Services, representing housing.
Great. We have, and I just put Eric on mute. So Eric? Oh, so that's him talking. Eric, you're coming through. It almost sounds, I think when you're talking, it almost sounds like a Disney character. I don't know. Yeah. If you're using your laptop microphone, maybe it would work better if you called in, if possible. Okay. So we have, did I see Kat? No, I saw Kendra. Kendra.
Hi, it's Kendra Palomares, representing community and faith-based organizations. Catholic Charities, sorry.
Wonderful. I see Loanne.
Good afternoon, everyone, and happy holidays. This is Loanne Ayers with United Way, representing nonprofits.
We have Martha.
Good afternoon, Martha Landman, Columbia County Public Health, Garfield County Health District, representing public health.
We have Ronnie.
Ronnie Batchelor, Lourdes Health Network. I'm representing the consumer.
Susan.
Good morning, Susan Grindle, Hope Source in Ellensburg, KCHN.
I saw Julie come on.
Julie Peterson, Kittitas Valley Healthcare, representing hospitals.
Terrific. And I think that was all the board members I saw. If I we'll switch over to Greater Columbia. So there's myself, Chelsea Chapman. I'm the administrative assistant. We have Carol Moser.
Carol Moser, good afternoon. Thank you for joining us, everybody.
We have Diane.
This is Diane. I'm here today.
Lauren.
Yep, I'm here. Good afternoon, everyone.
We have Brisa.
Good afternoon, everyone. This is Brisa.
I saw Sam.
Yes,
Sam.
this is Dan. Oh. This is Dan
All
Vicini.
right, Samantha. Welcome, Dan.
Sorry about that.
And then we had Sam as well. So then Wes,
Good afternoon, everybody. Wes Lucky.
Martine,
Hi, everybody. This is Martin Sanchez.
okay. Is there anybody I missed? Eric is, I'm sorry.
Your voice is coming through distorted. I cannot understand you, I'm afraid.
Oh my God. So unfortunately, Eric, it sounds like you've been sucking the helium from balloons.
I was laughing at Carol because Carol has been busted up over it.
Oh, it looks like Jan Ferguson just joined us.
Yes. Here I am.
Okay. All right, Sandra.
All right. And looks like Eric may have dropped off. But here he is. Let's see if we can hear him now.
I'm back. Can you hear me okay this time?
Much better.
Much better this time.
It happens about twice a week. I have to completely log out and come back in. So sorry I was a little late answering there.
That's okay. All right. We'll leave that to all of our introductions for now. As you know, there's our attestation of conflict of interest in self-dealing transactions. If you've not already committed that to memory, please review that now. And if you notice anything as we roll through our agenda that you would like to point out in regards to either one of those, please feel free to let us know. Moving on to our consent calendar, we have a lovely set of board minutes from November, which were set out and are very helpful. Has everyone had a chance to review those? Any comments, changes, point of note that need to be made? If not, I will accept a motion to approve those.
I motion that we approve them as written.
And this is Madeline. I will second.
Motion by Ronnie, second by Madeline. All in favor, say aye.
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 Anyone opposed, same sign. All right, minutes are approved. Carol, looks like you have a conflict of interest policy and bylaws on the agenda next.
Thank you, Madam Chair. So this is the time of the year that the Board of Directors reviews the annual conflict of interest policy, and we send it around for signature. This is part of our bylaws, and so this just allows us to keep current with any changes that might have happened for COI or bylaws. So you will be expecting to see those coming from Chelsea. There's a place for you to sign, and we'll probably just send them through DocuSign. Chelsea, did you need to add anything else?
I'm sorry, it takes me like 1 second to get off mute. Yes, so I will be sending these out tomorrow via DocuSign, and there is a space at the end. If you could please review, that would be great, and be looking forward to my email. Thank you.
Any other questions or comments regarding the conflict of interest policy and bylaws?
I'm sorry, I missed. When is that going out? Did you say tomorrow?
Yeah, he did say tomorrow.
These items should have been included in your packet. If you don't have them, please let me know and I will redistribute.
No, I meant the DocuSign. I have the bylaws. I meant the DocuSign.
That should be tomorrow.
Okay, moving on. We have our December GCACH report. So I will let staff take over and present that.
So you see this beautiful Christmas card or holiday card that we did virtually. It reminded us of our press conference that we had. So we decided to do the same thing with our holiday card this year, and everybody got in a position where they could show off a little bit of Christmas decor. And then we put the staff pictures together, and wanted to thank Lauren for following up and making sure that it turned out really great. So we sent this out via our email distribution, our MailChimp distribution. So hopefully you all received a Happy Holidays notice from Greater Columbia ACH. The next, and then we'll just go as we normally do. The staff will just take the articles that they wrote and just make any highlights or any notes. So I just wrote a little bit about change leadership and a really great article that I had read during November, and really talking about what does change leadership mean, especially in these unprecedented times. And it really took me back to the way that we're approaching practice transformation, is that we are requiring a lot of our leadership to make changes in their practices in order to be more efficient and more effective with the care that they deliver. So I just thought it was a great example of how we are using change leadership within our PCMH model. And it's hard work, so thank you all for pursuing that. I think Laurel's up next.
Hello. I have the privilege of working with Garden Village as their practice transformation navigator. And the story just highlights some of the things that they've been done. They're one of our cohort 3 sites. They've been participating in practice transformation since January of 2022. The Garden Village provides patients and their families with a holistic approach to long-term skilled nursing healthcare in an interactive and innovative environment. Their organization offers programs designed to serve populations whose needs cannot be met in a traditional nursing home, including residents with complex psychiatric issues and behavioral issues, and failed placements at other facilities. So since starting practice transformation, they've gone from paper to having an ONC certified electronic medical record. It's been tough for them, and they've had to do a lot of tweaking, but they're finding the benefits of that now and are really doing a good job with their reporting and tracking of their clinical quality measures. In response to the coronavirus pandemic, Garden Village has incorporated some other significant changes. They were not able to admit patients at all for a while due to the COVID-19 restrictions, and they had to develop a new physical setup as well as some new processes. So they're now able to admit again, and they have patients isolated for 14 days. They're watching them closely for signs of symptoms and testing them weekly, and that's since moved to twice a week. More recently, they have a negative airflow room that has been constructed to ensure that any patient who tests positive for COVID-19 is appropriately isolated and cared for. They changed their risk stratification to incorporate those patients that have tested or being tested or being watched for signs and symptoms of COVID-19 in their high risk stratification. So other thing that they're doing that's wonderful is their patients are all being screened utilizing the PHQ-9 screening tool, and they're monitoring them across time. So unfortunately, one of the things that they've been seeing is definitely an increase in those PHQ-9 screening scores related to this increased isolation that they've been experiencing. But allows them to keep a close watch on it. They do provide both physical and mental health services for their residents. And the team is just so upbeat and such a pleasure to talk to. They really are all in with their practice transformation efforts. So very, very excited to have them as one of our partnering providers.
So for our CopeCom Care Resilience Campaign, it is moving forward. We have partnered with Field Group for the media and the development of the toolkits that we're going to be sending out. We will finalize the logo and later today, this afternoon, at the meeting that we have with them weekly. And then we've also contracted with Catholic Charities, and they will be helping provide the training for the school districts and any other training that we would need to have happen. And I'm really excited about that. Chris has his team. They're meeting tomorrow to start the process. They've already sent it to all of the Catholic Charity school systems, and they were kind of our pilot to kind of see how this would go. And they're very excited about being able to have these, the toolkits once we get them completed. But we are moving at a pretty fast pace, and we're hoping to be full force in January.
So this information is a bit dated now. We have been getting some information from the Pasco Fire Department regarding the COVID test site that's on Argent in Pasco, relating to their volume. That red line indicates what their capacity is. So as you can tell, they've been working extremely hard and diligently out there to test the community. I know a lot of people who have went there, and it's really turned out to be a marvelous community resource. Needless to say, following the Thanksgiving break, a lot of people came out of that, and the amount of tests and the amount of positivity has increased because of the holiday break. Can you scroll down just a little bit more, Chelsea? There you go, a little bit more, please. So that test site has been a real success. The organization that helped stand that up, the Health Commons Project, which also did similar work on the west side of the state, has now worked with the test site at the HAPO Center, which is being operated by the National Guard. They were using a different laboratory and did not have any electronic scheduling system. So the Health Commons has taken both of those, University of Washington Medical Labs, which has been processing the CBC site, and their online registration application to automate that test site even more, to help it make it turn around test results quicker, and to make it maybe a little bit lower barrier to getting in and getting tested. And I think that that's it for that.
Wes and all, this is Eric. So as of yesterday, the CBC West has tested 34,678 people, in contrast to the National Guard site that this week is at 20,234. They were both at the exact same number just a couple of weeks ago. Whatever they are doing at CBC West is just phenomenal. They are crushing it. So pretty great work. Thanks for everybody that's been involved with that.
I have to say, and to take a little organizational pat on the back, I think a lot of this relates to our marketing efforts, the great ads that we've organized and put out on social media and on television. I think have just really become effective. The messaging as far as easy access and quick turnaround times, even though people have had to wait in line there, just about everybody that I've talked to has been really happy about it. There's been a little bit of feedback on social media by some groups who may be opposed to testing, or but that aside, Eric, it's just turned out to be a phenomenal success.
So continuing on the topic of the CBC West test site, we wanted to make sure to send our thank you to the hard workers at the COVID-19 test site. As Wes had mentioned, they've been really busy, which is awesome. We, as Wes said, would like to attribute part of that to our awesome marketing efforts. But that being said, again, we wanted to just show our appreciation for all the hard work that they have been doing for our community. And so we partnered with the Downtown Pasco Development Authority to organize a delivery of breakfast. The delivery was Thursday through Sunday. We wanted to make sure that we hit every shift. I know that they have about 75 employees and only 30 per day, 30 to 35 per day. So again, we wanted to hit all of those shifts and make sure everyone received that appreciation breakfast. So those breakfasts, again, were delivered last week, and everyone really appreciated them. We are also able to receive some thank you cards from one of the local elementary schools. Some students put together thank you cards for the frontline workers, and so we delivered those to the TED site as well. So again, we really appreciate all of their hard work, and we are happy to be able to deliver breakfast to them.
So this information is a bit of old news, and please forgive the typo here. It was at the November board meeting rather than this board meeting that the board approved HMA to develop a 3-year business plan for us. They'll be coming into the organization to help meet some of those goals, to identify and determine some business opportunities and potential related funding or revenues. They'll be looking at our portfolio of services. They're also going to be doing a ground-up assessment of our current business practices, our staffing, governance structure, job descriptions, the roles and responsibilities. They're really doing a comprehensive look of the organization to set up that 3-year plan that'll begin in late 2021. So we've worked with HMA in the past, very early on in the transformation work. They've proved to be good partners, and we're looking forward to working with them again.
And that work starts the beginning of January.
Thanks, Carol.
You're welcome.
Well, thank you everyone on staff for such a good report as usual. Are there any other questions or comments with regards to the presentation of the December GCACH report from anyone? All right, hearing none. Diane, you want to give us an update on the Community Health Worker Internship Program?
Sure. So we have developed a policy. We took it to the workforce committee, and we're still needing to kind of tweak it a little bit, as well as create the application that we will be giving to our organization so that they can apply for the funds. And we also met with Healthcare Authority and Department of Health, as well as Dan Ferguson, and to kind of level set where we're at and where we can work together. And I thought that meeting went very well. Healthcare Authority is really going to be looking at this program, and they want to help us in any way that they can. So they all definitely will be part of the workforce committee for the next little bit as we're developing the policy as well as the application. And we're hoping to bring that to you guys in the January board meeting.
Thank you, Diane. That's a reminder, if you didn't see Chelsea's email from this morning, those of you on the workforce committee, fill out your doodle poll for our next meeting so we can keep that moving forward. Now on, oh, go ahead.
Please, yes, please fill that out.
Yep, get it filled out. All right, moving on to our action items. November financial reports. Carol.
As you know, Becky Cohn has left our service, and so we are scrambling, filling in for her. I've been working very closely with the auditor and Northwest CPA and Sulamita to accomplish all the things that need to happen for the board. Right now, we're going to take a look at the financial statement of activity detail. Chelsea, it's the PDF. These reports were reviewed by our finance committee. Julie Peterson and Rhonda Huff and Kat were in attendance at that meeting, and Julie, I didn't know if you wanted to make any notes. This is really, the month of November was very commonplace, not a lot of unusual expenses or revenues. Julie, do you have any comments?
Not really. There's not much to say about November. It was pretty much business as usual.
So you can just scroll through, Chelsea. We had some marketing expenses for the masking campaign, a little bit of accrued interest, some computer technology. Payroll remains our biggest expense item in our statement of activity. We've got a number of subscription services that cost us a monthly amount. Martine and Brittany, we celebrated with them. They had their babies. So that was really wonderful to be able to send them some flowers and congratulations. We did have some professional pictures taken for new staff. You know, Sulamita and Brisa have joined our ranks, and so we like to get their pictures on our websites and out into the community. So total expenditures of about $92,300 for the month of November.
Great. Are there any questions or comments regarding the financials?
And I didn't know if you wanted to take a look at the budget, roll up budget versus actuals, kind of a year-to-date look at where we're at.
Yep, let's see where we're at.
Okay. So the first statement of activity is you have more of the detail in the version that we just showed you. But here we have kind of a roll up of the year in terms of what our revenue and our expenses actually look like. So we had taken out funding from the district account for such things like the rural, the assisted living campaign, the mask campaign. We received some money from the COBRES grant. We've made a little bit of money from the Washington Rural Health collaborative work that Sam and team are doing. A significant amount of interest. So we started the year with kind of $805,000 just coming into our operating funds. Then we had expenditures for contract services, some community engagement. You'll see the $90,000 for the local health improvement networks that came out of that funding. Part of that was Q4 expenses, because in 2019 we were still paying for the LHINs out of operating funds. This year we're migrating all of the LHINs to district funding, and so we're trying to get them set up in the portal. I'll be making payments on Monday for those LHINs that are out there wondering where your money is. So that will happen on Monday. Again, payroll expenses of about $901,000 at the end of November. Out of a budget of 1.1 million. I do anticipate we might go over a bit in December. And then that could have been due to the fact that you guys, staff, was generously given a small stipend, or actually a pretty big stipend really for the COVID. So that probably took us a little bit over when we see the year-end numbers. Again, professional services were way underutilized. Part of that will be spent in December. We were anticipating bringing on the business planning consultant in December, but they just couldn't arrange that for their schedule. So we're going to bring some of that money over in 2021. So we were pretty much underspent on professional services. Facilities and equipment, pretty close to what we had projected. Operational expenses, because of COVID, we haven't had the kind of meetings and expenses for our lunches and activities, that kind of thing. And we spent some money in marketing in December, so you're going to see that number go back up for December. Some car insurance, a little bit of travel, and then the funding coming out of those district investments for SNFs, internships, learning collaboratives, summit convenings, and that $137,000 that you see against the learning collaboratives, we will be carrying that forward into 2021 to use that money since we didn't use it in 2020. So we had a significant amount of money left in our operating revenues, and we didn't expend nearly as much as we thought. But I think that December you're going to see a little bit more expenditures coming through because we're making it for the year end and paying some bills that hadn't been paid due to the fact that Rachel Guest had left in July, and we were a little bit late on some of those payments.
Well, I have no doubt that we'll find a way to spend whatever money is left over next year.
It's true.
And hopefully that's a good thing and for good reasons and means we're back to normal. Any questions regarding the budget as it's been presented? I am looking for a motion.
Ms. Rhonda, I'll move to approve the financials.
I will second.
The motion from Rhonda, was that a second from Julie?
Yes, it was.
Okay. All in favor, say aye.
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 Any opposed, same sign. Les, was that were you approving or opposing? I saw a thumb come up.
Approving. I've got 2 meetings running, sorry.
Okay.
This is Eric. I have to abstain. Unfortunately, just as the report started, I had to take a call from HR, so I'll abstain from the vote.
Any other abstentions? All right. Thank you, Eric, for bringing that up. Thanks, Les, for the clarification. And those.
So no, I just had to assign a leader to the other meeting real quick. So right when you said to do vote, I was trying to get that done real quick. And anyway, thank you.
Too many things, Les.
Well, somehow Thursday afternoon they stack up. So
I hear ya. Well, the budget is approved, or the financial reports are approved, and now we will go ahead and move on to our district budget for 2021. Carol, if you want to start that.
Actually, Madam Chair, I'll just give a real brief financial audit update. As you know, we've been working on the 2019 audit. And I did have a conversation yesterday with CLA, who is our auditing firm. And the key takeaway is that as far as they are concerned, we will be receiving an unmodified audit opinion. Our financial statements are free of material error after adjustment. So that's the good news. I think we will see some major suggestions coming out of that audit. And one of my goals for 2021 is to replace Becky's position with a CPA position. I think we've recognized that our finances are very complicated, and our contracts are getting even more complicated. So this will be a really great time for the organization to bring in a certified public accountant to attend to all of our accounting needs and getting us straightened out and beginning our new business opportunities with confidence in our financial acumen. So I know Julie's very happy about that announcement.
I have to jump off, but I'm really pleased to hear that. And one of the conversations we had at finance this month is from a staffing perspective, this feels like a small business. From a complexity of accounting, this is big business. And I really applaud Carol's decision to get a CPA in there. You've got some very complex, particularly on the revenue side, stuff that's happening. So that's absolutely a great decision in my opinion. So I'm sorry, I got to go distribute vaccine. So, all right.
Oh, lucky you. Does that mean
Julie.
you get one, Julie?
Yeah, we got the Pfizer came in today. So yeah.
Wow. Congrats.
I have not gotten one yet. I'm way down the ladder on that. So, yeah. All right. Thank you.
Congratulations. Okay, now we can go to
Carol, I've got a question. Do you already have someone in mind, or is this going to be a competitive bid?
I do not have anybody in mind. This will be a competitive process. I'm still putting together the job description, Ronnie, but the nice thing is that CLA has offered to be part of our interview process. I am not an accountant. I don't have that level of confidence in my ability to pick the right person for this position, but having CLA by our side and helping us make that determination, I think is going to be very helpful.
Perfect. All right, now we'll do district budget. I've got to look at what's on the screen, not what came from my email. I had the wrong version of the agenda up, so.
Yes, it's been changed quite a number of times. Sorry about that.
That's okay. I should have double checked because it's clearly in front of me, but district budget for 2021.
I will take us through this with Wes's help. I asked Wes to reformat it because he does such a wonderful job using Excel spreadsheets. This is the same budget that the board of directors saw last month. Again, on the right-hand side, we've got kind of separate budgets so we can kind of tell what our cash flow looks like just for practice transformation. So you'll see cohorts 1, 2, and 3 on the right-hand side. With the total amounts being expected to be paid out for those cohorts. That just helps us internally understand how much money we're devoting to practice transformation. I think of note for this budget is, if you will scroll down a little bit, Chelsea, we're going to be investing a significant amount of money in other areas other than just practice transformation. We've got the community health worker program that we want to implement. We've got a community paramedicine program that we're going to try to roll out. We're going to do another round of the community health fund for $1.4 million. So just coming out of that community health fund is about $4.7 million. That's a significant amount of money for Greater Columbia to be spending out of the community health fund. But this is the year, 2021 is the year that we are hoping to transition all of our provider contracts or our providers into PCMH certified. If we can get our providers PMH certified, then that will enable them to make a little bit more in the billing that they send out. And it's just a nicer accreditation to have. And fortunately, our practice transformation navigators and team are becoming PCMH certified navigators so that they will be able to do some of that certification work. Contingency reserve, pretty much the same, and then staff salaries and benefits and expenses at about $1.4 million. So the total budget amount as presented last month is $15.673525. So a little bit more than $15.5 million that we'll be expending through our district funding next year.
Chelsea, can you go back to the top, please? Just to point out one thing relating to the milestone incentive budgets for the cohorts, you'll see cohort 1, cohort 2, and cohort 3. Cohort 1 is now on year 3 of practice transformation. You can see that schedule that we put there that has the yellow, the blue, and the green row. So for 2021, again, cohort 3, which has 45 sites, is on performance year 3. Cohort 2, which has 17 sites, these are all the behavioral health organization sites, will be concluding its last half of performance year 2 and its first half of performance year 3. And then cohort 3, which is a mixture of different organizations and has 18 sites, will be going through performance year 2. Each one of those performance years corresponds to a different revenue sharing model. And roughly speaking, the model halves every successive year. So year 2 is half of year 1 and year 3 is half of year 2, which we'll talk about here shortly. But in terms of how those dollars are allocated in those 3 columns to the right, just keep in mind that we're splitting it across those performance years.
Chelsea, do you want to go? Chelsea, could you scroll down a little bit more, please? Sorry, Sandra.
Nope, go ahead.
So the thing that I think is very confusing really is in the WAFI portal, the Washington Financial Executive Portal, you've got use categories that you assign to all of these different activities. So just a reminder to the board of directors, the use category that is aligned with some of these other areas, there's a crosswalk. So you might see in the revenue sharing model, fiscal stability through value-based payments. That is in itself has its own milestones, as you can see below in the rows that that follow, like empanelment, risk stratification, and that's because in working with Sam and Sam's team, these are the types of activities that health plans are looking for in terms of making value-based payment contracts, so that if you've got a panel of patients and you're keeping track of who your patients are, you're risk stratifying, you're creating opportunities and interventions for those populations that are at highest risk. What this really does is set up our providers, our smaller providers, for understanding what a VBP contract might look like. So we pride ourselves in this revenue model, and we kind of call it our own VBP model for our contractors and trying to get them used to this language. Again, a little bit further down on population health, we've got some milestones that relate to understanding how to use population health tools like Collective Medical and EDI, using One Health Port, and then some project incentives, really incenting providers to integrate bidirectionally between behavioral health and primary care. And I'm having a hard time reading here. Oh, and doing some follow-up care coordination. And then just a little bit further down, please, Chelsea. Our staff expense, our community health fund, and that's where you'll see the community health fund expenditure for 1.4 million, the community paramedicine program at 1.5 million, the support of our local health improvement networks, we have 7 now, the community health worker internship fund, a LIN training fund, we're trying to bring that back and offering our LINs some more training opportunity, the COPE Calm Care Resiliency Program that Diane talked about, and then our tribal investment. Again, this is that community health aid program that we'd like to help fund for the Yakima Nation, who is working with Heritage University on delivering that program in 2021. So again, the roll up of that budget's about $15.67 million.
As a percentage of the total budget, the cohort incentive funding is just a little over 50%. That if you go all the way to the right, that 7.913835 is just a little over 50% of the 15,673,525. So about half.
Any questions?
No, I actually I appreciate the layout this year. This is probably the easiest it's been for me to read and understand, since I did miss last month's kind of preview of it all. So thank you for that.
Okay.
Any other questions, comments regarding some of the lofty goals we have for the coming year? Lofty but achievable. Is there a motion for approval of the district budget?
This is Ronnie Bachelor. I motion to approve.
Thank you, Ronnie. Is there a second?
I'll second.
Or whoever else, Kat.
I think that was Kendra with the second, just
Was.
slightly, Eric. Okay.
Sorry.
All those in favor signify by saying aye.
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 Any opposed? Any abstentions? Just in case. All right. Well, that is approved. Motion carries. Yay. Good plan for 2021. Hope. All right. And next we have the revenue sharing model. Was like we got Wes Wes and Sam? I might have to open that up. That's tiny.
So can you go to that first table real quickly? And we're not going to spend a lot of time on this because there's a ton of detail, but there was also a ton of work done behind this. So this is a crosswalk between the NCQA PCMH scoring criteria, of which Sam is really an expert on this. PCMH, the recognition program, the NCQA PCMH recognition program is by far the most widely adopted PCMH evaluation program in the country. AAAHC has one, JCO has one, but NCQA is really the dominant accreditation organization. They cover around 13,000 practices, 67,000 clinics, and almost 100 organizations support NCQA recognition, providing financial incentives, transformation support, care management. When practices come under PCMH accreditation through the NCQA, it really expands the tremendous work that we're doing through the practice transformation model. So those columns on the green relate. Are we getting some feedback? I'm hearing some scratching. Maybe it's just on my end. The green columns on the left relate to an NCQA PCMH scoring criteria document that Sam extracted and presented to us, and then she and Carol and Laurel and myself, and I don't remember if there's anybody else on that call. We sat down and went through every single one of these 100+ NCQA criteria, and then crosswalked it to the Greater Columbia CARES model, the GCCM Practice Transformation Toolkit, which are those gray columns with the blue boxes. And as you can see, blue boxes correspond to NCQA criteria. They're not necessarily mutually exclusive. In other words, one of our milestones might cover more than one NCQA criteria. But almost everything matched in terms of the core requirements. There's a mixture of core and electives. All organizations for NCQA, to meet their accreditation standard, they have to meet all their core requirements, and I think 25 credits of elective. So we were able to match enough electives and every single core but one relating to medical home information, which is one that could be easily adapted to. And just to let you know that we have pretty good fidelity to the NCQA model. Let me stop there. Sam, is there anything else you want to say about that?
Yes, definitely. Around the milestones, so this actually sets the organizations up, those that achieve the majority of the milestones, a level 3 of achievement for certification. Around those 6 core categories, you have to achieve 5, and then there is the electives, and the electives really truly have, with the exception of the diversity, really stratifying those populations and looking all the way down to diversity and putting that in, those electives are achieved as well.
So, really one of the big overarching goals of our work is to get providers ready for value-based payment. And this is our foundational model, the Greater Columbia CARES model, and it's nice to see that it correlates with PCMH accreditation through the leading body that carries out that work. So while it's not a requirement of our practice transformation organizations, we would really like to facilitate them going through accreditation if they're not already accredited. Sam, again, is just a huge technical expert on this. And we're working to get our navigators trained so that they can actually help organizations go through NCQA accreditation. So let's go to the revenue sharing model, the next tab. There we go. Can you expand that, Chelsea, please? There we go. So this should look familiar. Those gray columns correspond. Actually, I should let Carol talk about this. I'm sorry, Carol, go ahead.
Well, this is, we probably should have approved this first before the district budget, because we built the district budget on all of these different payment schedules. But the payment schedule really is what Wes had talked about. The second year of practice transformation is worth about $149,454. If you could scroll down just a tad, Chelsea, you can see that it's the column at the bottom of the page. So that would be for year 2, cohort 3. And then for cohort 1, performance year 3, at the far right bottom is $74,727. So if you were a PCMH organization or under contract with Greater Columbia ACH and you scored 100% in all of these categories, by the end of the year, you would earn that amount of money. The difference this year that we made, in order to score it a little bit more easily, you'll see that we've combined some of these categories. So for example, care management, care coordination, training and mentoring, and assessments have been rolled up into one number. That allows a little bit easier scoring for our practice transformation team. Creates maybe a little bit more of a challenge for Dan Vizzini, who helps us figure out how to translate the scores and put them into the financial executive portal. But certainly you can see where the biggest emphasis still is for practice transformation. The reporting is a big ticket item, as well as a bidirectional integration, having your QI team, and then performing care coordination and doing the learning collaboratives and training and mentoring. Sam, was there anything else you wanted to say about the revenue sharing model for years 2 and 3?
No, just that there, again, for year 2, there was mandatory items that will continue in year 3 as well. And these are still not an all or none, but if they're in a category that is a all or none, it's actually going to be a point system. And Carol and I and Wes have been sitting down and trying to really assess. So for example, management, empanelment, restratification, all of those different categories there that are around 2A and 2B and 3A. And 4A, then if you chose, or if you're successful in reaching those milestones, for the majority of them, you might receive 90% of that credit as opposed to the 100% payment.
So just in part, Sam's strategy to do this combination is to help, in part, simplify the scoring process, which is part of a procedure that we've put together that I think we're going to be reviewing later on in the meeting to help with the issue of overpayment, which we're all aware of. We want to try to standardize that procedure, minimize activities that can be streamlined out to make it easier for Sam's team, for finance, for Dan, for everybody, to help prevent that from happening again.
And in addition to that, as you're well aware of, those that just transformation, you can't really build on these columns unless you start with the very beginning. So if you're not doing empanelment, then it's really hard to understand who the assigned team member is for that patient's population, to make sure that they're doing the care management around it, as well as the opportunities for those at highest risk, looking at your patients at higher risk, self-management support, just adding all of these different processes on in order to make sure that the care is the best quality of care is given to the patient.
So if you were to multiply those numbers in the bottom right of each color, the 149,454 and the 74,727, for those 2 performance years by the number of organizations, 45 for cohort 1, 17 for cohort 2, 18 for cohort 3, it should equal those 3 columns in that disrupt budget that we previously approved. It should crosswalk through.
It does. Don't say it should. It does.
It does. It does. We spent a lot of time on this. It better.
Does anyone have questions for Wes, Carol, and Sam regarding what they're seeing? Some of it's tiny, some of it's stuff we're used to. Some of it's used stuff where I think a lot of us are, it's presented in a way we're used to seeing it. It always gets a little confusing when you have so many different cohorts on different years.
It does, and this will become more familiar to those of us who are practice transformation organizations, as we will be carrying this through to the contract amendments that will be coming out next year for performance year 2 and performance year 3. So organizations like Sandra's and others, they'll be seeing this in the amendments that we put forward to your organizations.
And just to add, the funding amount has not changed. This is the exact funding amount that's been previously approved by the board. The approval request is for the categories.
All right. Any questions regarding the categories then? They look mostly the same aside from maybe a different grouping, which is, it makes sense, so.
Yeah.
And I believe the staff would like this approved, so if anyone is willing to motion.
This is Eric. I'll move to accept it as written.
This is Rhonda, second.
Thank you, Rhonda. All those in favor signify by saying aye.
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 Oppose? Any abstentions? Okay, motion carries. Thank you all for your work on that. I know it's a lot. Being a NCQA PCMH organization, we know there's a lot of steps and a lot of information, so I appreciate the fact that you guys are able to synthesize this for all of the rest of us. All right. Next on our agenda is the carryover funds for overpayment that looks like Sulamita.
And I am pinch hitting for Sulamita. She's off today. She has a birthday, so she's celebrating that. The question was asked by Luann Ayers last month. So for those overpayments that aren't going to be realized in terms of a credit in 2020, what does that look like? This is the schedule of the net overpayments due from partners, and we've been communicating with our partners to figure out, you know, what do they want to do? Do they want to carry the payment over to 2021? Do they want to close out their books for 2020? We did hear from Sundown M Ranch yesterday, who said that they're going to remand their payment to the WAPI portal. Otherwise, you can see that most everybody's carrying those payments over, which represents about $150,000 worth of overpayments going into quarter 1 of 2021. However, with the reconciliation between quarter 4 and quarter 3, you know, none of those credits will go very far, and they will be taken care of and absorbed in the first quarter of 2021, sorry. I don't know that there's really an action item on this, Madam Chair. It's just that we were trying to respond to Luann's a question on how much overpayment would be carried into 2021, and here's that schedule.
Carol, this is Luann. I'm confident your accountant has given you advice on how to account for these when you close out the calendar year financial statements. And I'm just curious, are these carried forward as an accounts receivable, or how are these carried forward?
That's a good question, Luann. I don't know. We'll have to get advice from Northwest CPA. And because they're all part of the district revenue, you know, they're still in the, you know, kind of associated with our district budget, not our operations budget. So there's nothing that passes through our operations money. I think it's more of an issue really for those providers that, for them, how they're going to account for that money that they have not earned. But it's, you know, more of a liability at this point. So.
Thank you.
Any other questions? And I don't believe that there is an action item on this, but I do appreciate the update and explanation of where we are with this, because I know that's never easy to kind of track these things down and keep a hold of them, especially when you've had key turnover. So I appreciate the work you are putting into that.
Madam Chair, there's one document that attaches to that in your stack of meeting materials. It's the very last one, called number 14, procedure for PT scoring and payment. Chelsea, would you mind opening that really quick? Thank you. So this is just to outline what we were talking about previously. Again, the practice transformation team, Carol, myself, finance with Sula, we walked through to try to standardize this process of who does what. I mean, this should seem obvious, but coming together, we realized that this was an important exercise. And we don't necessarily have to walk through this whole thing, but if you could scroll down, we just want to point out that we're trying to eliminate variation and waste in how this work is being carried out. So we've listed some steps that are part of this process that we hope to follow going forward. And Dan Vizzini has been real helpful in terms of being able to translate the practice transformation scoring into dollars, which goes into a file that's uploaded into the WAFEP portal. And we're also working on a process to load a similar document into CSI. Sulamita, Carol and I just about, we about had a heart attack when we saw how much work Sula had to do. She had to take, I don't know, a couple dozen milestones for nearly 80 organizations every quarter and hand enter each one of those dollar values into the CSI portal, which was just maddening. So we're hoping to turn that into one table and one data upload that actually could potentially save her days each quarter in terms of work. So this is the process that we're still refining and hope to put into place.
Great, thank you. I will say I have been in the financial section of the portal, and it is getting there. You know, you can see where you guys are starting to load in some information, so it's becoming more and more useful, I think, every time we go into that portal. So I appreciate that. It's always still hard. So I know I'm one of those people that harasses Sulamita for kind of some of the detail when we're reconciling our payments. So I appreciate the work going into this because I know it's not easy.
You know, Sandra, you're really a great evaluator, and if you have some specific things that you want to see changed with the financial portal, we are still working on it. Please feel free to make recommendations to Carol, Sula, and myself, and we'll carry forward that because we're meeting with CSI on a monthly basis to make system changes where needed.
Yeah, we'll do. I think it's just a matter of refining some of the detail because I think some things are provided just in a rolled up manner. And when we're managing to a contract that has a very detailed payment table, it's the dividing that out where it's just kind of like, okay, this probably is the detail is probably what's taking Sulamita the longest. And if there was an easier way to present that rather than a roll up, that's probably on my end the biggest takeaway because of course we're wanting to see, wait, which specific area do we as a contractor, are we holding up our end of the bargain and not holding up our end of the bargain on? And so and what was the root cause of that? Was it because we didn't enter in a number? Is it because it wasn't seen? Is it because it's coming still? It's the details.
No, that's good. And Rhonda, this pertains to you as well as and any other practice transformation organization. You know, the financial portal focuses on the financial side. In terms of the scoring and evaluation, that really comes through the practice transformation team. So I think the portal will be able to resolve some of those issues, but maybe not necessarily, to be honest, the reasoning behind that. But please reach out to your navigator, Sandra.
Right. Nope, we definitely do. All right. Chelsea, you want to pop that agenda back up? Perfect. Now it looks like we are back to our operations budget for 2021. Lots of good budget stuff happening today.
Thank you, Madam Chair. And again, this is the second reading of the operations budget. You saw this, some of the board members saw this last month. So we're carrying forward that $1.4 million from the district budget to pay for salaries in 2021. We'll have to draw down some money from our money market account in order to balance our budget. But if you'll see a little bit further down, we are anticipating some grants from the Washington Rural Health Collaborative, some of that work. We have a small contract with the Benton Franklin Health District. We'll realize some of the savings there. Interest, we're being conservative at about $40,000 for the year. We're carrying over $30,000 from the Coveries grant in order to maybe do some remodeling and create some more space in our offices so that we can hire that additional grant writer. And then we're hopeful that we'll get some other grants in the amount of $250,000. So we'll hopefully see that realized in 2021 for a total revenue amount of almost 1.71 million. Excuse me. In terms of expenditures, we have funding for our sponsorships and community events around $30,000. Again, our admin expenses that include payroll and taxes and benefits at 1.4, professional services and contracts, about 150,000, rents, utilities, janitorial. This is very similar to last year, cell phones, internet, property, D&O, and car insurance. I think that was pointed out to us by Ronnie at the last meeting, you know, what happened to that line item. So we popped that in. There's that $30,000 for possibly some design work for the office space. We've got our operational expenses that include our website, subscriptions, office technology, our printing and office supplies, food and lunch activities, marketing and communications. Lauren likes to have a little bit of money to work with in terms of our marketing for our organization. Hopefully we'll be able to do a little bit more business travel in 2021 and have some significant staff training with a total overall admin, project management, and operations budget of 1.8 million. Then you throw in the learning collaboratives. Again, that's funding that we're carrying over from the district budget. So our total expenses match our total revenues at $1,971,696.
Great. All right, you've seen this once, you've seen this now twice. Any other questions?
Yeah, this is Eric. I have two questions. Can you scroll up a little bit? And forgive me, I didn't take my Prevagen this week, so maybe I'm not remembering things correctly. Was there, oh, stop. So remind me with the vehicles that you guys did decide to buy out on the leases to own the vehicles. Is that right? Okay, so that's a fairly well known and understood. That's not going to change. That is decided. And does that happen this year?
Yeah, it happens in July, and it's a contract, so we know exactly how much it's going to cost us to buy out those leases.
Perfect. And then my other question was related to, I remember we did some things for staff because of the modifications or things they needed to do with their homes. And were we anticipating anything like that going into next year? And did I miss it on the line?
I didn't add it in.
But that's still something that could be there, and we have revenue available if something needs to happen, right?
That would be great.
Okay.
Thank you.
That's it. Thanks.
And Carol, just a quick question. Can you remind me the point person for sponsorships or to receive requests for sponsorships again at the ACH?
That would be Lauren.
Okay, great. Thank you.
Oh, I see Dan's wheels turning. He's getting ready now. Be prepared, Lauren. You've been warned.
I'm ready. Bring it on, Dan.
Well, it's actually just referring others, of course. You know, my other day job is just connecting, right?
Yeah, when you're not in the airport, Dan. Or even there, actually.
I know. When the staff at the airport know you by first name, then that tells you something, right?
Any other questions or comments? Anyone want to motion to approve?
I'll move to approve.
All right, thank you, Les. Is there a second?
I'll second.
Thank you, Eric. We have a motion, we have a second. Last chance for questions or comments. Okay, all those in favor signify by saying aye.
Aye. Aye.
Any opposed? Any abstentions? Okay, we have ourselves a 2021 budget. The motion carries. All right, looks like we have a nomination for a new board member. Carol?
We were notified by Ron Anderson, who is a commissioner for Yakima County, actually last month, that LaDon Lindy would, he was recommending him as his replacement. LaDon Lindy, I think he was appointed when Norm Childress, the county commissioner, passed away in 2020. So Ron is recommending that LaDon Lindy be his replacement. We're excited about that. We have not been able to connect yet with LaDon. We've tried several times, and so hopefully he'll be able to accept this appointment. But he has a healthcare background. He was served as the medical compliance officer for Estrella Sunnyside. And now he is working full-time as a Yakima County Commissioner for District 3. So we're hopeful that he is able to take this nomination and appointment, but it does come through the Board of Directors for approval. The nominating sponsor was Commissioner Ron Anderson.
And Carol, this is Rhonda. He's also LaDon. He's actually very well versed. He's been there for quite a while, and his wife is the chair of, or she's past chair of the Sunnyside School District, very involved in our healthcare coalition. She drags him along on all of the masking surveys, and he's also the representative for to our Yakima County Homeless Coalition. So very defined in housing issues. So I would make a motion that we appoint LaDon Lindy to the board.
All right.
This is Madeline. I will second that.
All right, we have a motion from Rhonda and a second from Madeline. Any other questions or comments? I guess my only comment would be in the event that we can't get a hold of LaDon, or LaDon does not feel he has the time to take on another role. Hopefully we're at least keeping an eye out for a possible alternate, just in case. I don't think that'll be the case in this instance, but we should still keep our eyes open because you never know.
I agree, Madam Chair. We'll definitely, I think he's just been really busy with his new appointment.
Yeah.
And when we found out, it was the day of our November meeting. So even though we tried communicating with him, we just didn't get through. So I'm hopeful that, and then he had an interview this morning on some kind of a news station. So I wasn't able to contact him. But now that he knows that he has been accepted, I'm sure that he'll be more than excited to take this board position. So.
I am sure. All those in favor signify by saying aye.
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 Any opposed? Any abstentions? Okay, the motion carries, and we look forward to working with LaDon on this board. All right, on to our discussion items. Lauren, do you want to start us off on the 2021 Lynn contract review?
Yes. Carol, do you want me to go through this in depth or just an overview of what we've changed?
What about just going through the changes, Lauren?
Okay. Okay, so Chelsea, just like we did for the quarterly Lynn meeting, can you just kind of pause when we get to a highlighted section? So what had happened was Carol, Wes, Reese, and I kind of dissected this contract and made sure that all updates were made in preparation for 2021. So in our 2020 contract, we had language in here about the Community Resilience Campaign. The board's very familiar that we did not continue this campaign. Instead, we will be replacing that campaign with the Cope, Calm, and Care Resiliency campaign. So we just added a definition in here about that since we reference it throughout the contract. I also noticed we referenced milestones a lot, but didn't necessarily define it. And so we added a definition for milestone. This language was updated prior. I believe it said that either party may terminate this agreement up until 14 days. We updated that language to read 30 days to be consistent with other contracts that we had. We also updated the date from 2021 to 2022. Same with this next highlighted section. It previously said 14 days and now says 30 days. This previously said Becky's contact information. We updated to read Carol's information. And then scope of work. So we added an introductory paragraph under the scope of work talking about the important work that the LHINs do for our region. So we just wanted to change it up a little bit. We know we've kept the same contract language for a couple of years now, so we added in that definition. We also went through this, I just wanted to say we went through this with the LHIN leaders, and they really liked all of this language, so their changes have been incorporated. But for Part C, this was language from the previous contract as well. We just changed the section, the LHIN shall confirm or identify the top priority social determinants of health. So that allows each LHIN to decide whether they think their social determinants of health that they have identified are still the top priority social determinants of health in their region, or if they think they need to re-identify those. So that gives the LHINs a little bit of flexibility on if they want to go through that process again or not. Part D, we just updated that language to read Cope, Calm, and Care Resiliency Campaign instead of the Community Resiliency Campaign. Part E, we thought this would be important to add in the LHIN contract. What we learned kind of through this process and through some staff turnover is that we really need to focus on meeting with our LHINs and making sure that they know exactly what their deliverables are and that we have that clear line of communication between Greater Columbia ECH and the LHIN leaders. So Part E just really allows that. Our Community and Tribal Engagement Specialist, Brisa, will be reaching out to the LHIN leaders to schedule a quarterly meeting individually with each LHIN leader, and this will just allow them to have that conversation about upcoming deliverables, any questions they might have, and clear up any questions we might have.
Just to add a little bit to that particular section, meet can be virtual. It doesn't necessarily have to be physical, given the current circumstances.
Yep,
so,
thanks.
So why is it the tribal engagement person specifically they're meeting?
Because that's who is managing these contracts and that relationship with the LHINs.
So I guess what I'm being that specific, then if you have a staffing change, it's not, you can't move this to somebody else's responsibility unless it's directly related to tribal relations, but I don't think it is. Yeah. It really doesn't matter. It's just I've had a couple changes in things, and you can't be too specific sometimes.
The position has been consistent for a while now, Les, with Ruben preceding Brisa, and Lauren is now the manager for Brisa. So I don't think this is going to be an issue in terms of having some consistency with that position. Sorry, Lauren.
That's okay. Go ahead and scroll down, Chelsea. So part F, this is consistent with what we had previously in the contract as well. It's just facilitating a collaboration with the Win2Run representative to review the local community resource directory on an annual basis. The board is very familiar that we funded Win2Run to help them make some updates to their platform. And so, you know, that platform's only as good as the resources that are in it. So we want to make sure that those LINs are helping Win2Run and keeping that resource directory up to date at least once a year.
And again, this is just their own local resources. So we're not asking the LINs to go throughout the whole state, but to take a look at Yakima. Is there anything that changed that, you know, is a really important partner that should be in that Win2Run directory? So it wouldn't be up to them to put that organization in the directory, just to note to the 211 representative, hey, looks like that you need to follow up on some of these other organizations that could be in the directory. So it's just a, as we move forward with improving clinical community linkages, those resources are only as good as the providers know how to reach them. And so there might be some really great resources in your community that you would like to refer your clients or your patients to. If they're not in that directory, there's less of a chance of that person getting the right referral. So hopefully this will help our community health workers and peer support specialists that rely on these resources in a directory. And then hopefully during the year 2021, we're hoping to work with 211. We understand that they might be coming out with a referral platform or partnering with VisionLink. That's a conversation that we need to have with Madeline and Win2Run. But we're really hoping to elevate the whole clinical community linkages aspect of our work in 2021. And this is one of the ways that we can get that local input that we think will be really helpful to our provider organizations.
In our contract with Win2Run on their side, which facilitates, which supports the same end, will help ensure that this particular milestone is met.
Thanks, Wes and Carol. Wes, do you want to talk about number 2 since you added that one?
Yeah, so we've added this in here because this is really one of our payment milestones. The Greater Columbia has pay for performance incentives, pay for reporting incentives, and we also have VBP incentives that are built into the Medicaid transformation work. And one of those payment milestones relates to notifying our provider organizations about the value-based payment survey, which comes out in the second half of the year, facilitated through HCA. And if you've attended our leadership council where we've talked about this, JD Fisher is the one that works on this and reports out on this. So this is just a notification that goes out to your organizations. We're not asking you to make sure that everybody does it. We're just simply asking for them to be aware of when that survey happens. And we'll work on our end to find out the timing for that. So as we get closer, Brisa can contact your organizations and give you more detail that you can simply drop into some sort of correspondence. So I don't think that this is really a big ask.
Thanks, Wes. And then number 3, we just updated that language from the Community Resilience Campaign again to the COPE Calm and Care Resiliency Campaign. Scroll down, please, Chelsea. That section we just updated to 2021 from 2020. Same with the next 2. We just updated the language from 2021 to 2022. And then for O, we added LINs to create a sustainability strategy to prepare for 2022 and beyond, since we aren't quite sure how long we will be able to fund the LINs. And then this last section is the milestone reporting schedule. We made quite a few changes to this. We realized that there were some sections in the scope of work that weren't necessarily highlighted in the milestone reporting schedule, so it was a little bit confusing to the LHINs on when those items were due. So we wanted to make sure to clearly outline that for 2021. I'll just go through each quarter. Under quarter one, COPE Common Care Resiliency Campaign, collaborating with that. We had mentioned in our previous contracts that we wanted the LHINs to advertise their meetings, and I know a lot of them are doing this and part of their distribution list, but we didn't necessarily identify that in the milestone tracker, and so we added that information in. We also added, again, the information about meeting with a community and tribal engagement specialist, and we changed the payments. So previously, quarter one, the payment was $10,000. We changed that to $5,000 since we didn't feel there weren't as many tasks to be completed as quarter two. So previously it was $10,000 for quarter one, $5,000 for quarter two, $10,000 for quarter three, and $5,000 for quarter four, and we just blocked all of those payments. The LHINs were okay with that. They're still receiving the same amount of money, so that's great. Something I also wanted to note is we changed the completion dates. This allows the LHINs a 15-day grace period from when that quarter is due to turn in those deliverables. And when we send out this finalized contract to the LHIN leaders, we're going to make sure that they know we are very serious about these dates this year. They're due dates for a reason. We want to make sure to get LHINs those payments on time. We don't want to be paying LHINs for quarter one deliverables next year in quarter one. We want to get those payments out on time. And so by doing that, we need to have the LHINs turn in those deliverables on time as well. So that's quarter one. Quarter two, we talked about reviewing local 1-2-1 database, confirming or identifying top social determinants of health, again, meeting with community and tribal engagement specialists, and those advertising efforts. Quarter three, talking about the VBP survey, the quarterly meeting with community and tribal engagement specialists, and again, advertising efforts. Quarter four, I noticed that we did not specify that we need the LHINs to attend that quarter four LHIN leadership meeting, and so I added that information in there. Advertising efforts, again, meeting with community and tribal engagement specialists, again, that sustainability strategy, which is a new component for 2021, and then that 2021 final budget report, and then that final $10,000 payment. And those are all the changes.
Lauren, did you want to also mention that we're trying to put all of the LHINs on the same schedule this year?
Yes, so we noticed when looking at past contracts that they're all the LHINs are kind of on a different schedule, and so our goal for 2021 is to have all LHINs sign their contract by February 1st so that they're all on the same cycle.
Lauren, did you? Sorry, go ahead.
Sorry, just a quick comment on the quarter four deliverables for the LHIN. The way, might want to clarify that that's participation isn't just showing up, but actually presentation. Because that's what we've had before. So I'm assuming that's what you're actually meaning, is that they would participate and give an update in quarter four of their LHIN activities. And participation is somewhat open to interpretation as maybe just attending. Just my 2 cents on that language.
That's a really good find.
You know, Sandra, we've put together a reporting tool. I don't know if we included it in the packet, but for each of these deliverables, it goes into more detail about the expectation for each. Was that part of the packet, Chelsea? I don't think it was it?
No.
So that'll be turned out, and you'll see more detail about how to meet each one of those deliverables, Sandra.
Yeah, that's a great point, Wes. Just to talk a little bit more about that document, the LHINs had some questions on how exactly they can complete each of these deliverables, and so we put together a template for them. And so, for instance, you know, it'll say monthly GCACH Leadership Council meeting attendance. This one's really obvious, but underneath it, it will show that example of how exactly you can complete that deliverable. And we have that for each deliverable as outlined in this schedule. So it's more clear exactly what we're looking for.
I do like Sandra's suggestion, however, Lauren, of being a little bit better clarification on the participation for Q4, because it really, it's the participation, it's the presentation of their efforts during the year. So we'll make sure that we clarify that item number 2.
So Sandra, are you talking about the presentations at the Leadership Council meeting?
Yeah, that's kind of what, yeah. So that's kind of what I'm assuming that's what you're actually meaning. And the way I read that, I would not know that if there's a clarifying document, that's helpful. But if the way I read that in the contract, it's not how I would interpret that. I would interpret that as like, I got to show up in Q4 to the Leadership Council meetings versus providing an annual report in Q4 at a Leadership Council. And just being more actual specific as to what that deliverable is.
Yeah, so we have number 4, and that's presenting at the Leadership Council meeting, and I could see how that's confusing.
Oh, okay.
And then we have number 2, which is just the Lynn quarterly Leadership Council meeting with just the Lynn leaders, where, you know, that's just our quarterly meeting. So I think we could maybe clarify on number 4 that it's the Leadership Council meeting.
Okay. I didn't touch that.
Yeah, we'll adjust that.
Yeah. Okay. And so we will see this again next month then, as it is our first reading. And would it be possible to see the document that kind of just provides clarification as well, so that folks can see what that looks like?
Yes, definitely.
All right. Chelsea, do you have our agenda? Perfect. Thank you. All right. 9-county masking campaign / advertising for the COVID vaccine.
It's another Lauren.
Yeah, so we were talking about during our last meeting a 9-county masking campaign, and we're really just starting the process of this. But then we started talking about, well, what if, you know, the COVID-19 vaccine were to come out at the same time? And look, here we are. It is coming out at the same time. So we're wondering what maybe suggestions the board has on our efforts in advertising for the COVID-19 vaccine. I know that we, Carol West and I attended a meeting the other day talking about advertising for the vaccine, and they were taking our feedback on, you know, what suggestions we have. So we talked about creating flyers. That's really helpful. Videos, of course, all different languages. There's a lot of information that needs to get out about the vaccine. I know that there's a lot of people opposed. So Carol and I even talked about maybe having flyers at the COVID-19 test site. However, we know our contract ends at the end of December. So it's really just a discussion piece, gathering some thoughts or ideas maybe from the board. And Carol might have some more to add to that before we start that conversation.
I just know that there's a lot of questions out there. We've been trying to work with the Benton Franklin Health Department on getting that information out. They have been reluctant to put any information out because the Department of Health is really taking the lead on most of that messaging. So I think that they're kind of waiting for instructions from DOH, but I would think that Yakima, you have a couple of community test sites as well. So we'll be working, you know, early in 2021 to try to solidify what type of materials can we add at those community test sites to get that information out. And then obviously, what are we going to be posting on our own website and our Facebook pages?
DOH had a presentation today for providers. One of the things I had to get off on before I got on another thing. Anyway, and they were talking about how to communicate. And I think that some of that information is being developed now, and they're being very aware of other different people's concerns and feelings, and trying not to overload people, but really meet them where they're at. I thought they had some real good ideas.
So within my own organization, I've been tasked with identifying the number of our individuals who are willing to get the vaccine, and at current 50% of our people are planning to get the vaccine, but those that are not are all on the fence, haven't decided, want to wait and see what happens to other people, or are adamant no. And it's a pretty equal spread between those three other options. So what I'm discovering is that before we consider putting anything out, I think it'd be great to identify what the public out there needs. I mean, obviously there's huge safety concerns. There's so much misinformation, and there are some really good short videos, like 4 minutes long, on both Moderna and Pfizer, that even talk about how messenger RNA works, and you're not going to grow a fifth limb. It's not going to change your genetic makeup of your body, But anyway, so I think a survey would be great, to find out what the people are looking or need to know, and then framing it from there. That's just my 2 cents. It's what's helping me in my small little world here.
So this is Rhonda. So we did a survey with our staff too, and it was and 100% of our medical providers said yes, and with the rest of the staff it was, like Eric said, 50-50. But the minute that the medical providers started saying that they were getting it, that's what changed the opinions. And so what we're doing is we're sending out messages from our medical providers and having the medical providers do their, obviously when we haven't got the vaccine yet, but when it comes in, the medical providers are going first, and we're going to publicize it, and that's what's changing the minds. And we'll do another survey in a couple of weeks, and we believe that's strongly that's what's going to make the difference. We're already seeing it. The staff are already saying they've changed their minds just from the statements from the medical providers.
Carol, this is Martha, and we're also working on that in the public health realm with Department of Health. They're working on a toolkit. They're working on multi-language messaging, working on different messaging for different communities, to get the priorities out there. We're just waiting. In my communities, it'll be a little longer to get vaccines, so we're delaying a little bit until we can see that we're going to get some before we deliver the message too soon. And the information, quite honestly, is still changing on a lot of the documents. Probably 2 or 3 times a week, I'm getting updated forms and information as we go through this first couple of weeks. So probably by the first full week of January, I think we'll be a lot closer to some toolkit and some Department of Health messaging that we can use across.
That's really helpful.
There's a real issue with timing sometimes. So you get something out too early, or giving a chance for a lot of people to complain and really give a negative message. So to put out figure out the right time to put out a message, it has to be close enough to where that choice I can act on. So it's sort of a delicate balance, because we're all in we're in that, what do we call it, pandemic, whatever, where we don't really care about tomorrow. You know what I mean? So people you know, so what 3 months down the road? I'm worried about me today or this afternoon. So I think there's some psychology in how we can do this. But you guys have done good with taking messages, general messages, and applying them to our community. And I think that would be figuring out how that message can be interpreted for, you know, one of our sub communities may be useful. DOH puts a lot into this, but to personalize it for our community, I think what Kennewick did some time ago, basically saying we're choosing to do the masking and the distancing because this is what's good for our community, through you know, firefighters and different community people. And I thought that PSA would be, I don't know how effective it was, but I thought it was a very good positive messaging.
It was Pasco, but thanks.
Oh, I'm sorry. I thought it was.
I totally agree with what Rhonda was saying. I just wanted to add one last little thing. The one difference, and I agree, our providers are within our organization, when they hear Dr. Hodges is doing it and this person and that person, they are. I do not think the public will be as easily swayed. They are not frontline. There's still that disillusionment. This is not going to happen to me, so it doesn't matter if I have a vaccine. You know, so I do think we have to consider obviously the audience.
Yeah, the other thing I'd like to bring to light that is the amount of extra work this is going to be on the hospitals or the clinics or the people giving the shots. Not just in our small communities, but everywhere. The forms to fill out. I was just on a call with our local hospital today, and the amount of time it's going to take to fill the forms out, have the people ready, have a facility that those people can social distance while they're waiting their 15, 20 minutes after the shot in the middle of February, and still be able to do a fair amount of shot inoculations within a week to be able to proceed forward and to be able to get to our population in the 5-month time frame that we have, or 7-month time frame that is expected of us, is going to be a real challenge for our hospitals. It's added manpower. It's not going to take away the number of tests that our hospital has to do. It's not going to take away my contact tracing, any of that right away. And it's going to be a lot. So I don't have an answer to additional staff that we're going to need. The hospitals are going to need to do this. It's really come to light in a lot of my conversations.
Carol, this is Laurel. I had to step away for a moment, so I didn't hear the beginning of this item that we're discussing. But I did want to mention in a conversation with one of my practice transformation sites that there was a mention of the specific the messaging that goes out, and that we would definitely want to have a message geared toward the Latinx community. That there's a significant amount of distrust in regards to the vaccine. A particular provider had mentioned in California that they were able to gather data and understanding that, and it sounds terrible, but you know, in this day and age, I guess we need to kind of open our minds to listen to what might be going on out in the community, that, you know, it's geared towards harming the Latino community, and, you know, it's just not good. And so I guess one of the things that we've heard such good feedback on is how we did our masking campaign and geared it particularly towards that community. So I guess, I don't know if you'd mentioned this already, but I think it would be important to go ahead and think about gearing towards that community. And actually, the individual that mentioned it to me said, I have nurses, and you know, there's people even that are at other sites that in the Walla Walla area that would love to, the Latino leaders would love to be videoed getting their vaccination. So just wanted to mention that.
You know, there's still some low-hanging fruit, though. I think advertising for the vaccine and getting the buy-in is a challenge, and I think it will be a little bit easier in some of the healthcare facilities, but there's still going to be a large population. But the masking campaign, we still have to mask. It's going to be a long rollout for the vaccine to get distributed. I think we can still get a lot of use out of that masking campaign with some slight tweaking and getting that out through the counties. Just because a few folks in the healthcare, I mean, we're talking how many thousand, a small number really of these initial vaccine doses that are just hitting our doorsteps before the end of the year. And it's, going to take February before people even get really what they're requesting in this first round. And then there's, of course, that priority ranking of who gets it and who becomes eligible for it as vaccine shipments arrive. That we still need to really enforce the masking. People won't have their second dose or injection for a while still. So that's something I think that we have that could maybe just only require a little bit of tweaking and still have a lot of value.
I agree with all of these comments. We don't want to get ahead of the messaging, and several of us attended that DOH webinar just the other day, and it was great feedback. Some of the things that Laurel just talked about, messaging that's pertinent to the Latinx community of different, ages. I think the Department of Health is actually doing a really good job of trying to drill down into the correct messaging that resonates with each one of those audiences. So we'll try to stay abreast of that, not get too far ahead of that. A conversation at the local decision makers meeting on Tuesday, Sandra, about the very thing you were talking about is just a small amount of vaccines right now. That doesn't mean we need to let up on social distancing, washing our hands, wearing face masks. So all of these messages that can be reinforced at the local level, we'll stay on top of it. And Lauren didn't mention it, but she's going to be doing some filming on Friday and Monday for the round 2 masking campaign in Yakima for the English-speaking audience, and has some really nice interviews lined up, including Carlos Oliveros, who's agreed to be interviewed, and Arlen Washings from the Yakima Nation, whom I'm hoping delivers his messaging in Yakima, in his native tongue. So we're excited that we're being able to work with local community members. That's one of the things that I took away from that meeting, that webinar, is that you've got to use trusted messengers for people to really resonate with the message being spoken. So that's why we're using so many different people from Yakima, from different walks of life, from different interest groups, and represent different populations.
Ronnie, you've had your hand up for a while.
Yeah, I have. So we did the same thing in our care system. Who's going to be wanting to get the shots and stuff? One of the things that I found, though, is with my friends, they were all like, "No, I'm not getting that. I don't trust it." But one of the things that I did was say, "Well, I'm getting it regardless, and I want you to be safe. Wear your mask. Get your shot." And then I'm finding out that went a long way, because now everybody that I was talking to is saying, "Okay, we're going to follow you because we trust you. We trust you know what you're doing." And I don't know what I'm doing, but I know that I want to get the injection and I want to be safe. So I wear my mask, and I will be getting the shot. So I mean, and as far as how to administer it, we're already doing the COVID testing drive-through. Why couldn't we do that as well? And we have the ability to do the community, to have that and do a buddy plan, plan with your buddy to go do that together,
Yeah,
so that the support there.
Drive-through is the monitoring your person after they've done 15 minutes or a half an hour after the shot, to make sure they don't pass out or something. And if they're driving a car, it may be a little more of a worry. I'm sorry, but I think it's a great idea. We've done flu drive-throughs, so maybe we just do you park in slot 2, you park in slot 3, and I'll be by in a few minutes and check on you, kind of thing. Could work.
It's not an option right now.
One of the this is Laurel again. a recent Washington State Hospital Association COVID information meeting had someone from Spokane, I'm sorry, I can't remember the entity, and they demonstrated how they're doing vaccinations for children because they've noticed their children were getting so far behind on their vaccines because they weren't coming in to their primary care providers. So they did have a drive-through for children. The vaccinations were done in their car, and they programmed in a waiting area, and they utilized nursing students to be right there monitoring for the prescribed amount of time to look for any kind of a reaction after the vaccinations. And they put it all in a really nice a video and gave supplemental materials for people that would like to set up that type of program for the noticing that, you know, that might be coming our way with the COVID vaccination programs.
I think there's just some logistical things specific to this vaccine with the way that it has to be stored and the fact that, you know, once we take it out of storage, we can't refreeze it. And I trust that all of the appropriate leaders are working towards that. And I think we have a lot more information to come on how we can actually administer it when we get enough doses to do kind of the larger community vaccine events. And so I think it's good we're having the conversation today so that it's at least on our thought radar for what we can do. I do think, you know, I'm glad to hear that there's some more masking videos that are going to be coming out, because I think that's going to be really helpful, because we're not out of that world yet as far as the pandemic's concerned. So I think more to come. I don't know if that really helped you, Lauren, as far as, you know, which direction to go or keep us headed towards.
Yes, it does help me.
Okay.
Thank you. Thank you for everyone's feedback.
Yeah, any other questions or comments on that? Okay.
Who wants to be my buddy for the shot?
What was that, Ronnie?
Who wants to be my buddy for the shot?
Well, we'd have to be socially distanced buddies, but, you know, whenever I get a chance, you know, just throw me in a line anywhere. I don't care.
So can you do it as a Zoom buddy?
Maybe. All right. Any other items to bring before this committee, this board?
Maybe just Mr. Nielsen might want to make an announcement.
Yeah. I was sitting here regretting making this announcement. So right after the first of the year, I will unfortunately be tendering your resignation to the board. I think that's the appropriate term. Unfortunately, and this is not as a result of COVID, it's as a result of a number of other changes within my organization. I've had a lot of stuff put on top of me. You've probably seen me move to the side and take a couple of phone calls even during this meeting, and it's really preventing me from being able to be as focused and tuned in to this position on the board as I think is required of a board member. So I'm going to be unfortunately stepping away from the board. I will not step away though until we have a replacement in ready to go. There's too many important things I think going on with the board. Well, there always has been, but that I don't want to do that. So I've committed to Carol and to Wes to provide some options for them, and I will stay here until we're clear on the path forward. So it's been, and it's not the last time you'll see me, but it's been an honor and a privilege working with you guys on these things. I already miss the lunches.
So do I.
I'll really miss having lunch with Ronnie. So anyway.
You know, I just want to say quickly how much of a resource Eric has been, not just being a great participatory board member, but helping us with the Image Trend pilot project, a potential community paramedicine cohort. Eric's just been super knowledgeable, super helpful. So we're really, really grateful for his participation.
I will echo that because Eric, you have been very consistent in showing up for meetings. I remember the days when we struggled to fill that slot. So thank you so much for your service. And I think all of us understand how other priorities can kind of pile up and have to make us make some decisions that we maybe don't want to, but are probably for the best. So thank you. And thank you for sticking around long enough and to help find a replacement. Hopefully you find someone who could fill your shoes.
Well, let me tell you, I work with a lot of great men and women. We have phenomenal EMS and fire resources all throughout the Mid-Columbia, so it will not be a difficult thing to locate. So, but thanks, Sandra.
Anyone else? No one else can leave now. There's only one for the year. This counts for 2021.
We need to have some kind of Zoom party for him when he leaves. Because I do miss having lunch with you, Eric, and you were always a great lunch partner, and you always had great ideas, you know, so we got to have a Zoom party.
Just don't talk about me like I'm dead, okay? Just
it's not a way.
Good ideas. They just won't be here with the board.
We should at least find a way to deliver lunch to you. You might not have time to eat it now that we're not quarantined. There's not making you sit in a room with us, but. Okay. Anything else?
We can invite him to lunch with us from time to time, just so we can see his face.
I like it. Guest speaker.
Okay. I see Kat has her hand up.
Yeah, I just wanted to let folks know that this is my last board meeting. As you all might recall, the managed care organizations rotate on an annual basis, and so Kate Mundell from Coordinated Care will be representing the managed care organizations in January. So thank you all so much for all that you do for the Greater Columbia community. And of course, I won't be far away. I'll still be on. I just won't be in the official board representative seat. So thank you.
Thank you, Kat. We appreciate you participating too, and hope that you will still continue to participate in PIBA when there are things that are important from our MCOs. Okay. Well, our next meeting is scheduled for Thursday, January 21st, but if there are no other agenda items.
Before we go, Dan just sent out a link to the Sentinel Network.
Yeah,
Dan, was there something?
I was busy trying to locate the link and get it in the chat. But so the Sentinel Network, as you know, is an effort by the Workforce Training Board and the Center for Health Workforce Studies. And recently, this year particularly, it has done a lot of surveying around the state around the impact of COVID on development. And there's a lot of interesting findings, updated findings around, you know, what organizations had to do. And you all know what organizations had to do because you are the organizations. And Greater Columbia continues to be one of the all-star providers of information to the Sentinel Network. And it is very, very interesting information. And thanks for, that must be Chelsea or Lauren that's doing that right now. Thank you for that. So I would just encourage you to take a look at that. And we're continuing to try to adapt our health workforce programs to reflect the numerous changes that are occurring as a result of this pandemic. So yeah, that's why I put that in there.
Okay. Thank you, Dan. All right, I think all that's left is to wish everyone a Merry Christmas, Happy New Year, Happy end of Hanukkah, Kwanzaa, all of the holidays.
Great.
Hope everyone is staying safe and finding ways to find cheer and joy, even though it's kind of a different holiday season than we've seen before. So
thank you for sharing, Madam Chairman.
Yeah.
Anytime.
Were you recently on the news? Just got to ask a question. Were you recently on the news about masking and the vaccine? Do you hear me or not hear me?
Can hear you.
Carol.
So what are you asking?
She's on the
Were you recently on the news? When they were doing the vaccine?
She
and-
comes on nightly. She
Yeah,
comes on
I mean, I
nightly.
was like, that was a quick clip of her. I was mad because they didn't let you talk. And you always have good information to pass on. I was a little bit put aside for that. You know, I was like, what? She didn't say anything? What's wrong with these people?
I just applied, you know, the modeling for how to swab the nose. That was basically it. So,
So you guys mentioned some of this, but the governor and Department of Health and everybody have kind of announced that the plan is to get schools running. So I expect in January and all that, we're going to see a real push to get kids all back to school, at least hybrid, and hopefully beyond that. But there's a real shift and that happened because the research shows that we're not transmitting the disease in schools. Kids and adults are giving it to each other out of school, and if it's in school, it's usually the break room with the staff or something like that. So they've done a fair amount. We haven't had a lot of high schools in, so I'm really wondering what's going to happen when high schools get in. But schools seem to be a safe place, so I'm looking forward to seeing more kids getting, to go back to school. I think a lot of parents are too.
yeah.
We'll see how that goes. Certainly a controversial issue.
I think even the kids are excited to go back to school for once.
For sure.
After being home with the parents all the time? Oh yeah, I'm going to school. If it's offered. I think that with my nephews, they're not going to go back because everybody in the house has been tested. They stay to themselves. And with the special needs and the health disparities that they have, they won't be coming back. They're going to be just teaching from home. But there's a lot of families that definitely need school because the kids and the parents don't educate one another. They kind of agitate one another more, and school provides that kind of safety net for them.
So I just, in case you were wondering, that's kind of a big sort of shift that happened yesterday. So.
Yeah. Thank you for updating us, Les. Well, I got to take off, everybody. Happy holidays. Thanks
Happy
again,
holidays,
Sandra.
everyone.
Bye, you all.
Bye.
Bye. Happy holidays.